Hello, everyone, and welcome to the Daily Senior Safety Advice Podcast. This is the show that's all about helping older adults stay safe, independent, and comfortable at home. I'm Esther Kane, a retired occupational therapist, certified aging in place specialist, and a dementia care specialist. I am so glad that you're here with me today, especially for this particular episode, because this one takes let's just say a little bit of courage to talk about. So before we start, please make sure to hop on over to seniorsafetyadvice.com for more tips and resources. And if you find this episode helpful, subscribe to the podcast and or our YouTube channel, or both actually, and please share it with someone who might need it. The word of mouth is everything for a show like this. All right, now today's topic is incontinence. Bladder and bowel control challenges, and how family caregivers can help an aging parent navigate this with dignity, safety, and real practical support. Now, it's one of the most common issues that older adults face. And honestly, it's common issues that a lot of pregnant women face and other age groups, depending on, whatever illness or disease they're fighting. But it's one of the most rarely talked about, and for good reason. People are often embarrassed about it, humiliated by it, and they even have difficulty talking with their doctors about it. But if it's a problem that you're dealing with, you have to know that there are resources out there. There's tools, there's equipment, there's products, there's things you can do. So that's what we're going to talk about today. All right. So let's just, be plain talking about it. Incontinence is any kind of trouble controlling the bladder or the bowel or both. It affects millions and millions of older adults and a lot of other age groups, as I said. It's incredibly common, and yet most families deal with it in whispers, if they deal with it at all. Now, I've worked with thousands of older adults over the years who were quietly managing this on their own. They were skipping outings because, they were afraid of an accident. They were avoiding drinking enough water because they thought that that would help. And they were embarrassed to tell their doctor, as I've said. And they were exhausted from dealing with it alone. Of course, naturally. So if this is something that you are going through, or your parent is going through, or someone you love and know is going through, I want you to hear this first. You're not alone. This is not a failure, and there is so much that can be done. I have to tell you that in my clinical experience, incontinence is one of the leading reasons that older adults become socially isolated and stop engaging in activities that they normally love. Addressing it practically and compassionately can restore confidence and quality of life in ways that go far beyond managing the physical symptom. All right, let's start by clearing up a really, really common myth. A lot of people, and honestly a lot of older adults themselves, believe that incontinence is just a normal part of getting older, something that you just have to accept and live with. That is absolutely not true. Incontinence is common, but it's not inevitable, and in many cases, it can be significantly improved or even resolved with the right help. That might be a simple change in fluid habits. It might be pelvic floor exercises. It might be medication. It might be a combination of things. But the starting point is always the same. A conversation with the doctor, because before anything else, it's important to understand what's causing it. Now, there are different types of incontinence, and the causes vary. Stress incontinence, that's the kind where a sneeze or a laugh causes leakage. Usually a lot of pregnant women have this, and afterwards, after having the baby, they have this problem. And this is different from urge incontinence, where there's a sudden, intense need to go and not enough time to make it to the bathroom. Now, some people have a mix of both. And for older adults with mobility challenges, there's also what's called functional incontinence, where the problem isn't the bladder at all. It's that getting to the bathroom in time is physically difficult. Understanding which type is happening or which type is happening the most matters because the solutions are different. So that's why I always encourage families to advocate for a proper evaluation, not just a quick mention at a regular checkup, but a real conversation where the doctor digs into what's actually going on. And I do want to say, and I'll say it again later, but this information in this podcast is not to be taken, from the perspective of a physician. I'm not a physician. I am just giving you the common knowledge about incontinence that I believe most family caregivers and older adults should know. You should always, always speak with your physician about medical issues and mental issues as well. All right. Before the doctor's appointment, keep a simple log for 3 to 5 days. Note what your parent drinks or what you drink, how often you or they use the bathroom, and when incontinent accidents happen. That information gives the doctor a much clearer picture than memory alone. Now let's talk about the home environment because this is where I spend so much of my time as an occupational therapist, looking at the space someone lives in and asking, does this home make it easier or harder for this person to get to the bathroom safely and in time? And the honest answer is that in a lot of homes, it was harder, not safer, sometimes much harder because maybe the bathroom was upstairs and there was no bathroom on the main level. Or maybe the length from the living room where they normally spend time to the bathroom was too long for that particular person. Now, think about a typical bathroom. There's often a step to get in. It doesn't have to be a step up or a step down. It's normally a step over a threshold. The toilet is lower than ideal. There may be rugs on the floor that shift underfoot. The light switch might be around the corner from where you walk in, meaning that someone is reaching for it in the dark and possibly twisting to turn it on. And at night, when the urgency is often greatest, all of these things become much more dangerous. Falls in the bathroom, especially at night, are one of the most common and most serious accidents older adults experience. And the rush to get to the toilet in time is one of the biggest triggers for those falls. I know I've mentioned this story before, but I want to say it again. My mom-in-law was in her 90s when one night she called me in a panic. She had gotten up in the night, gotten onto her wheelchair, and to get to the bathroom, which was the right thing to do. She was right, she was safe, but the problem is that there was a threshold between the bathroom and the bedroom on the door in the doorway. She did not have enough strength to push the wheelchair over the threshold. So she was trapped. She was stuck. She was crying. She was embarrassed. She was upset. We had to get someone there to help her. It was not a good situation. So if you think that little tiny threshold does not or would not cause a problem, please think again. Make it absolutely flat. Okay. In the home assessments that I have done in the past, I frequently found that the bathroom layout itself was a primary barrier to incontinence management. A raised toilet seat, a grab bar beside the toilet, a night light in the bathroom, in the hallway, or even a motion light of the bathroom that turned on and off with motion, and removing a single throw rug could collectively reduce both accident frequency and fall risk all in one visit. Just those few items. So what can we actually do about the environment? Well, let's walk through a few things that make a real difference. The path to the bathroom matters enormously. At night, make sure the entire route from the bedroom to the bathroom is lit. Plug-in night lights are inexpensive and incredibly effective. Motion-activated ones are even better, because your parent doesn't have to fumble for a switch. Inside the bathroom, a grab bar next to the toilet is one of the most impactful changes that you can make. And actually, if need be, you can add grab bars throughout the bathroom to get to the toilet. It depends on how your bathroom is. My mom's bathroom had this long hallway to get to the, once you walk from the hallway into the bathroom, it was a long hallway. And then she finally got to the toilet. So we had grab bars on that wall in that long hallway. Those grab bars give your parents something solid to hold on to while they around the toilet while they lower themselves and rise back up again. And that confidence alone can make the experience less rushed and less dangerous. Now, grab bars need to be professionally installed into wall studs, not just mounted with adhesive. This is worth doing right. Do not use those suction grab bars. These need to be properly installed. Now, the other thing that can help in the toilet area is a raised toilet seat. That's very simple, practical help, unless, of course, you want to completely change the toilet itself to a taller toilet. And this is especially true for someone with hip or knee pain or just simply limited leg strength. Getting down onto a low toilet and then back up again is genuinely hard work for many older adults. Raising the seat height, even a few inches, changes the mechanics entirely, especially if they have the grab bar there to help them. And of course, if they have use of their upper body and upper body strength. And if your parents' bedroom is far from the bathroom, or if your bedroom is far from the bathroom, or you or they are dealing with nighttime urgency frequently, then you may want to consider using a bedside commode. It sounds like a big step, but for someone who is waking up multiple times a night and rushing down the hall in the dark, a bedside commode can actually be the thing that keeps, them safe. And dignity-wise, it's far better than a fall. Believe me, because it wouldn't just be the fall. You would fall and then have the incontinence issue on top of that, on the floor, on your clothing. So when introducing adaptive equipment like a raised toilet seat or bedside commode, frame it around comfort and safety, not around the incontinence itself. That may help to accept this new product. This will make things, or it could make things, so much easier on your, you could say something like, this can make things so much easier on your knees, lands very differently than a conversation focused on accidents. If you basically focus on the positive versus the negative. So let's talk about products, because the options have come a very long way. Absorbent underwear and protective pads are dramatically better than they used to be. They're slim, discreet, and genuinely effective. For many older adults, using the right product gives them the confidence to get back to activities that they've been avoiding. Going to church, going to a grandchild's event, going out to lunch. The key is finding the right fit and the right absorbency level for your parents' specific situation. This might take a little trial and error. Some families find it helpful to talk to a continence nurse specialist. Yep, that's a real specialty. Or to ask the doctor for a referral. These professionals can recommend the right products and put a real management plan in place. Now, skincare is also something I want to mention because it matters more than people realize, I think at least. Skin that's frequently exposed to moisture can break down quickly, especially in the skin of an older person whose skin is already more fragile. Now, keeping the skin clean and dry and using a barrier cream as needed is an important part of preventing skin breakdown, discomfort, and even infection. If you notice any redness or irritation that isn't resolving quickly, please, that warrants a call to the doctor. Get to the doctor quickly. Don't wait, because they often get much worse before they can get better. Skin integrity and incontinence management are deeply linked. I worked with families who were so focused on managing the incontinence itself that they missed early signs of skin breakdown, which can progress quickly in older adults. Now, a simple daily skin check can catch problems before they become serious. Now, I want to take a moment to speak directly to the caregivers that are listening today, because this particular caregiving task is one of the most emotionally complex ones that there is. For your aging parent, there's often enormous shame attached to this. Needing help with something so private, something we're taught from early childhood to handle independently, can feel humiliating. Your parent may push back on help. They may get angry. They may insist they don't need anything. And underneath all of that is usually fear and embarrassment. Now, the most important thing that you can bring to these conversations is matter-of-factness. Not pity, not alarm, not over-explanation, just calm, practical, caring help. Deliver it the same way that you might help someone who had a difficult time opening a jar. It's just something that needs handling. No big deal. That tone, more than anything else you do, can help to protect your parents' dignity. And for your own sake, please don't try to manage this entirely alone. If hands-on personal care is becoming a regular part of your caregiving, it's worth talking to your parents' doctor about what level of home care support might be available. A home health aide trained in personal care can take on some of these tasks in a way that may actually feel less awkward for your parent than having you do it. Sometimes a bit of a distance actually helps. Now, if your parent has dementia, establish a consistent toileting schedule. That helps. Offering a bathroom trip every 2 hours rather than waiting for them to ask. Many people with memory loss lose the ability to recognize or communicate the urge in time, and a proactive schedule can dramatically reduce accidents. I do want to mention that you can call a home health agency and I would call several actually, to see what they can offer you as far as a home health aide. The other thing that you can do is contact a geriatric care manager in your area. A geriatric care manager is the person that has the list of all the resources that you could possibly need to help you with whatever it is that you may need as far as caregiving or aging in home or looking for assisted living or senior living of any kind. So those are two types of places that you can contact for help. So here's what I want to leave you with today. If incontinence is something that your parent is dealing with or that you're dealing with, whether you're talking about it or not, please know that help exists. Real, practical, effective help. Of course, start with your doctor. Look to find out what is actually causing the incontinence issue. There may be medication or other treatments that can help. Beyond that, look at the home environment with some fresh eyes. Consider adaptive equipment, find the right products that work for your needs, and above all, bring kindness and calm to every interaction around this topic. It's a difficult topic for people to talk about. Your parent is the same person they've always been. They just need a little more support right now. And you reaching out for information just by listening to this episode already tells me everything I need to know about the kind of caregiver that you are. So keep going. Believe me, you're doing a beautiful job. All right, I want to thank you so much for being here today. I know this wasn't the easiest topic to sit with, but you showed up, and that matters. So for more resources on home safety, caregiver support, aging in place, and much more, please visit seniorsafetyadvice.com. Everything we've talked about today and so much more is waiting for you there. And if you're looking for local aging in place specialists, home modification professionals, or elder care resources near you, then head on over to aginginplacedirectory.com. There are knowledgeable, caring people there ready to help. Please, of course, remember to subscribe to this podcast and YouTube channel, wherever it is that you're listening to us from. Click the like button if you like the episode. Give us a review, comments, because all of that helps us and helps the algorithm to get the podcast out to more and more people. And if today's conversation helped you, or if you think it might help someone else, then please share it. You never know who needs to hear this. All right, everyone, I'm Esther Kane. Thank you for listening. Thank you for caring so much. And I'll be right back here with you tomorrow. Or actually, the next day. Robin will be here tomorrow. Take care of yourself. You deserve it just as much as the person you're caring for.